All right, today we're going to talk about the medical emergency epiglottitis. So, signs and symptoms of epiglottitis are going to be pretty distinctive. That's definitely something you're going to want to be able to recognize from a question stem so that you know what disease process the NCLEX question is trying to get you to pick up on. So, signs and symptoms are going to be a sore throat, an increased work of breathing, fever, tachypnea. But the two cardinal signs that will give away this question as epiglottitis will be drooling and a bright red edematous epiglottis. Often the question writers describe it as cherry red. We have a photo here on the right to show you what it would look like. The drooling is because the epiglottis is so inflamed that the child isn't able to swallow their own secretions. This is usually found in young children, often during flu season. So the next thing that you want to know for these questions on the NCLEX are the do's and don'ts. This is likely going to be a nursing priority question where they ask you what your priority nursing action is. So what you do want to do for a child that you suspect has epiglottitis is obtain blood cultures, keep them quiet and calm, and notify the provider. This is considered a medical emergency, and any intervention that the NCLEX writers come up with giving you, the priority is going to be maintaining a patent airway. This epiglottis is so swollen, the child is at serious risk of losing their airway. So you want to keep them calm, keep them quiet, try not to get them worked up, and go ahead and get your provider. They will likely need to be emergently intubated. All of the things you don't want to do with epiglottitis are take an oral temperature, attempt to visualize the posterior pharynx, ask the child to open up and say, ah, obtain a throat culture. And if you notice a theme with these things, these are all items that could cause laryngospasm and lead to loss of an airway. Laryngospasm is when you irritate those vocal cords, they spasm, and your airway closes up. You can't pass an ET tube. It's very difficult to obtain a definitive airway after laryngospasm. With epiglottitis, they're at very high risk for this, so we don't want to do anything to irritate the throat. Don't put anything in there. Don't ask them to open their mouth. Once you see that cherry red epiglottis, they're drooling, they have a fever, they're tachypnic, you suspect that this is epiglottitis, you want to get your provider immediately and continue to keep the child calm. That's everything you need to know about the medical emergency epiglottitis.